Welcome to another episode from the Veterinary Research Channel. Today, we will be discussing a fascinating study that explores the clinical relevance of serum ionized magnesium concentration in dogs with myxomatous mitral valve disease, also known as MMVD. This research, conducted by Kim et al., delves into how magnesium levels might serve as an indicator for the severity and prognosis of this common heart condition in canines. To begin, myxomatous mitral valve disease is the most prevalent cardiac issue in older, small breed dogs. The gold standard for diagnosing MMVD is echocardiography. However, as MMVD progresses, it can lead to congestive heart failure, or CHF, which is often accompanied by electrolyte imbalances, including magnesium. These imbalances are believed to arise from neurohormonal activation, undernutrition, and diuretic therapy. In human medicine, hypomagnesemia, or low magnesium, is associated with cardiovascular disease, CHF, arrhythmias, hypertension, and the worsening of existing conditions. Although ionized magnesium constitutes a small fraction of total body magnesium, changes in its concentration have been observed in humans, dogs, and cats with certain diseases. It's crucial to measure ionized magnesium directly because it cannot be accurately predicted from total magnesium levels. Given that ionized magnesium is physiologically significant, studying its relationship with CHF is more valuable than assessing total magnesium concentration. Despite studies on the correlation between CHF and electrolyte imbalances in dogs, research on the relationship between magnesium and CHF in veterinary medicine is limited. This study aimed to address this gap by investigating changes in ionized magnesium concentration in dogs with CHF, its impact on prognosis, and its correlation with echocardiographic measurements. The study involved 181 client-owned dogs with MMVD classified into preclinical stages, NOCHF, Stage C, and Stage D, based on the American College of Veterinary Internal Medicine MMVD classification. The researchers compared ionized magnesium concentrations among these groups and used statistical methods to analyze the incidence of death and the association of hypomagnesemia with mortality. The results indicated that in the Stage D group, representing more severe heart failure, the ionized magnesium concentration was significantly lower compared to the NOCHF and Stage C groups. Survival analysis revealed that hypomagnesemic dogs had a notably lower one-year cumulative survival rate of 53% compared to 91.5% in normomagnesemic dogs. Multivariable analysis further confirmed that lower concentrations of potassium and ionized magnesium, along with higher peak E-wave velocity, were associated with negative prognosis. Specifically, hypomagnesemia was linked to an approximate fourfold increased risk of death. These findings led the researchers to conclude that assessing ionized magnesium concentration could serve as a potential marker for estimating the severity and prognosis in dogs with MMVD. Combining ionized magnesium measurement with other diagnostic methods, like echocardiography, may enhance the prognostic evaluation of MMVD in dogs. Now, let's delve into the specifics of how this study was conducted. The researchers retrospectively reviewed data from 2 referral centers, examining charts of dogs that had undergone echocardiography. The dogs were referred for suspected heart disease or management of refractory CHF. All medical records were based on the dog's first visit to these centers. The study was approved by the hospital directors, with an institutional animal care and use committee approval not required due to its retrospective nature. To identify cases of MMVD, the researchers reviewed echocardiographic records and selected dogs with MMVD for further analysis. Each dog underwent echocardiography, electrolyte analysis using plasma samples, and thoracic radiography. Exclusion criteria included concurrent malignancy, serious systemic disease, missing data, or gastrointestinal diseases affecting electrolyte concentration. Dogs with suspected kidney disease were also excluded. Importantly, dogs receiving diuretics were not excluded. Blood samples for laboratory analysis were collected via venipuncture or after intravenous catheterization and placed in lithium heparin tubes. Samples were analyzed using a blood gas and electrolytes analyzer within 15 minutes of collection. The analyzer provided reference ranges for sodium, potassium, chloride, ionized calcium, and ionized magnesium concentrations. Corrected chloride concentration was calculated using a specific formula. Echocardiographic evaluations were performed using 2 different ultrasound units. Mitral valve prolapse, mitral valve thickening, and mitral regurgitation were assessed. Measurements included left ventricular internal diameter at end-systole, left ventricular internal dimension in diastole normalized for body weight, the ratio of left atrial diameter to aortic diameter, peak E-wave velocity, and isovolumic relaxation time. Heart disease staging was determined by reviewing electronic chart records, radiography, and echocardiography records. The authors reclassified all dogs' heart disease based on the American College of Veterinary Internal Medicine MMVD classification published in 2019, blinded to electrolyte analysis results. The study included dogs with preclinical stages B1 and B2 and CHF stages C and D. Specific criteria were used to classify dogs into NOCHF, stage C, and stage D groups. Statistical analyses were performed using commercially available software. Normality was assessed, and appropriate parametric and non-parametric tests were used. The chi-square test was used to investigate differences in the proportions of hypomagnesemia among the groups. Spearman correlation analysis tested associations between echocardiographic measurements and electrolyte concentrations. Receiver operating characteristic curves were used to determine diagnostic sensitivity and specificity for electrolyte concentrations. Kaplan-Meier curves were generated to determine the cumulative incidence of CHF-related death, and Koch regression analysis was used to estimate associations of hypomagnesemia with death. Now let's look at what the study results actually were. The study identified 224 dogs with MMVD, with 181 meeting the inclusion criteria. The study included 108 dogs without CHF, 42 dogs with controlled CHF, stage C, and 31 dogs with refractory CHF, stage D. The most common breeds diagnosed with MMVD were Maltese, Shih Tzu, miniature poodle, Pomeranian, and mixed breed. Electrolyte profiles and echocardiographic measurements were classified according to the American College of Veterinary Internal Medicine stage. The average ionized magnesium concentration was 0.38 millimoles per liter. Ionized magnesium concentration was significantly lower in the stage C and stage D groups than the NOCHF group, and was also significantly lower in the stage D group than in the stage C group. The proportion of hypomagnesemia varied across the groups, with 80.6% in the stage D group compared to 14.8% in the NOCHF group and 45.2% in the stage C group. Echocardiographic measurements were significantly higher in the stage C and stage D groups than in the NOCHF group, but only the left atrial to aortic diameter ratio significantly differentiated stages C and D. Of the electrolyte profiles, only ionized magnesium was significantly correlated with all of the investigated echocardiographic measurements. Ionized magnesium showed a weak negative correlation with the left atrial to aortic diameter ratio, left ventricular internal dimension in diastole normalized for body weight, peak E-wave velocity, and E/IVRT. The receiver operating characteristic curve showed that an ionized magnesium concentration of less than 0.35 millimoles per liter was associated with CHF stage, demonstrating a sensitivity of 60% and a specificity of 85%. It was also associated with stage D, displaying a sensitivity of 81% and a specificity of 77%. Follow-up data were available for 131 dogs. During the follow-up period, all the dogs in the NOCHF group survived. 85% of the dogs in the stage C group survived, whereas only 9% of the dogs in the stage D group survived by the end of the study. The Kaplan-Meier curve demonstrated that the mortality rate in the hypomagnesemic group was higher than that in the normomagnesemic group. In the multivariable analysis, the final model revealed significant associations of potassium, peak E-wave velocity, and hypomagnesemia with death. For each 1 millimole per liter decrease in potassium, the risk of death increased approximately 3.8 times. An increase of 10 centimeters per second in peak E-wave velocity was associated with a 33.6% increased risk of death. Hypomagnesemia was associated with an approximately fourfold increase in the risk of death. Now let's put all of this together. The key findings of this study were that the plasma ionized magnesium concentration was lower in dogs with more advanced CHF, and that the case fatality rate was higher in dogs with MMVD with low ionized magnesium concentration. This suggests that a decrease in ionized magnesium concentration in CHF is associated with lower survival rates in dogs with MMVD. In this study, 45.2% and 80.6% of dogs with stage C and stage D disease, respectively, were hypomagnesemic. These findings suggest that hypomagnesemia is more likely to develop as CHF progresses, aligning with findings in human medicine. The etiology of hypomagnesemia in CHF is multifaceted. The use of diuretics, secondary hyperaldosteronism, increased norepinephrine, and an edematous state could all interfere with magnesium absorption. The final multivariable survival analysis underscored several variables influencing outcomes in dogs with CHF. Diminished levels of potassium and ionized magnesium, coupled with elevated peak E-wave velocity, correlated with negative prognosis. There was a significant association between hypomagnesemia and increased risk of death, with hypomagnesemic dogs having approximately a fourfold higher risk of death than normomagnesemic dogs. The one-year survival rate was 91.5% for normomagnesemic dogs, whereas hypomagnesemic dogs had a significantly lower survival rate of 53%. In human medicine, magnesium deficiency is known to be associated with life-threatening ventricular arrhythmias and sudden death and heart failure. Decreased magnesium concentrations could be associated with cardiac cachexia, and increased mortality might be related to escalated diuretic doses in diuretic-resistant CHF. Magnesium can also inhibit plasma aldosterone secretion, reducing sodium and water retention. Currently, routine supplementation of magnesium in hypomagnesemic patients with CHF remains controversial. The American College of Veterinary Internal Medicine consensus on MMVD states that monitoring of magnesium in CHF dogs and supplementation with magnesium could be recommended in the presence of hypomagnesemia. Nevertheless, studies on the effects of magnesium supplementation on prognosis in dogs with hypomagnesemia caused by CHF are still lacking, and further research is needed. Echocardiography plays a pivotal role in understanding the hemodynamic status in MMVD, predicting CHF, determining when to start treatment, and evaluating treatment effectiveness and prognosis. In this study, echocardiographic measurements were significantly higher in the stage C and stage D groups than in the NOCHF group. Echocardiographic measurements showed a weak negative correlation with ionized magnesium concentration, an ionized magnesium concentration of less than 0.35 millimoles per liter predicted CHF stage with a sensitivity of 60% and a specificity of 85%, and predicted stage D with a sensitivity of 81% and a specificity of 77%. These results suggest that the measurement of ionized magnesium concentration could serve as a marker for indirectly assessing the severity and prognosis in dogs with MMVD. There are several limitations to this study. First, as a retrospective study, it was vulnerable to confounding factors and could not identify a causal relationship. In addition, increased mortality was found in dogs with low ionized magnesium, but the direct cause of death was not investigated. Furthermore, the use and dosage of diuretics were not considered, and electrolyte measurements might change over time. Finally, data were collected from 2 different centers, which could introduce variability. In conclusion, in dogs with MMVD, a lower ionized magnesium concentration was associated with higher case fatality rates than normomagnesemia, suggesting that ionized magnesium might be lower in dogs with more severe CHF compared to non-CHF and mild CHF. In addition, ionized magnesium demonstrated a weak negative correlation with the investigated echocardiographic measurements. These findings suggest that ionized magnesium concentration could serve as an additional marker to estimate the severity and the prognosis of MMVD, complementing current diagnostic tools. By incorporating ionized magnesium assessment into the prognostic approach for canine MMVD, it could provide valuable insights into the disease severity and prognosis. Further studies are warranted to determine the relationship between the direct cause of death in CHF and ionized magnesium concentration, and to assess whether magnesium supplementation ensures a better prognosis. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.